Today I'm going to talk about the physical aspects of laser therapy in the medicine. And first of all, I'm going to give you a short overview of what I'm going to talk about in the following minutes. I will start with the topic, what is a laser therapy? So what can we understand under it. And yeah, after that, we're going to talk about what the laser therapy is used for. And after that, how is the laser therapy done. Um, right after that, I would like to tell you something about the different types of laser therapies that are available and also what the risks and the benefits are if somebody decides to take a laser therapy. Yeah, and in the end, I would like to tell you what happens after laser therapy and what results we will get. All right, so first of all, what is laser therapy? Um, yeah, laser therapy is the medical treatment that is used to take focused light. And unlike most of the light sources, light is from a laser, which stands for light amplification by stimulated emissions of radiation. And this laser is tuned to a specific wavelength, what means you can specify how strong or how deep the laser should go into the tissue, for example. Yeah, this allows it to be very focused and to produce a very powerful beam. And the laser light is so intense that it can be used to shape diamonds, for example, or steel. So you're very accurate with this laser and you can very precisely determine how and where it should be applied. In the medicine, the lasers also allows a surgeon, for example, to work at a very high precision by focusing on a very small area. As I already mentioned, it is very easy to edit the laser and to show where exactly it should hit. And because of that, you will damage very less of the surrounding tissue, what is pretty good for the patient because it will cause less pain or unnecessary scars, for example. If you have a laser therapy, for example, you will also experience less pain, as I already said, but also your swelling and your scarring will be less than within a traditional surgery, for example. So, however, the laser therapy can also be very expensive and requires a lot of preparation and yeah, also repeated treatments because one session will not make it. Okay, what is a laser therapy used for? Um, Overall, you can say that the typical treatment is used, for example, to shrink or to destroy tumors or polyps. You can also reveal symptoms of cancer, remove kidney stones, remove part of prostate, for example, or also repair detached retina, like in the eye surgery. Yeah. Also, lasers can be a cauterizing or snelling effect that may be used to seal, for example, nerve endings or to reduce pain after a surgery. That also happens very often, for example, when a patient loses a leg or, in general, an extremity. Also, blood vessels can be, yeah, healed or at least be treated to prevent blood loss. And lasers also are very useful to treat early stages of some cancers. For example, vaginal cancer, perineal cancer, and cervical cancer. Um, Besides that, the laser can also be used in cosmetical treatments, for example, to remove warts or moles, and also birthmarks and sunspots, for example. Besides that, laser can also be used to remove hair from a patient or also to remove tattoos. But as I already said, you will need more than one treatment, so you will have to use several treatments with the laser to get your final results. How is a laser therapy done? The laser therapy techniques are very based on the procedure. So you will have different treatments for different goals, or also different treatments. Um, if, for example, the tumor is being treated, an endoscope is maybe used to detect the laser and to view tissue inside the body. And the endoscope is inserted through an opening of the body, for example, like the mouth. And then the surgeon aims the laser and shrinks or destroys the tumor. So it is directly applied in the patient, for example. In contrast to that, in a cosmetic procedure, the lasers are usually applied directly to the skin. What are the different types of the laser? Yeah, very common laser surgeries include, for example, refracting eye surgery. It's very often called a LASIK. The tooth whitening, you can be using the laser and you will see it very often. Also, cosmetic scar or tattoo or wrinkle removal is very common. And yeah, besides that, there's the argon lasers that make very shallow cuts and can be used to activate photosynthesizing drugs, for example, during photodynamic therapy. This type of cancer treatment is combined with light and with the chemotherapy to kill more cancer cells. So you will make it more useful and more effective. There's also the low laser therapy, the LLT, and is also called the cold laser therapy. It uses laser light set to wavelengths between, like, as I mentioned in the beginning, around 600 to 980 nanometers. And the laser is used to perform very minor surgeries and promote regeneration in the tissue. What are the risks of the laser therapy? Of course, there are some risks, like in every treatment. And the risks for the skin therapy, for example, include bleeding, infections, as always, when you treat somebody and there will be open wounds. Pain can be caused, scarring can occur, and also changes in the skin color. Um, Also, the intended effects or treatment may not be permanent, so repeated. Yeah, repeated sessions will be needed. Some laser surgeries are also performed while you're under general anesthesia, which carries its own risk of set of risks. Sorry, they include, for example, pneumonia, the confusion after waking from the operation, heart attacks in the worst cases, and also strokes. What are the benefits of a laser therapy? Lasers are definitely more precisely than a traditional surgical instrument and can cut very small scars, so they're always or mostly shorter and shallower. And this, as I already mentioned, causes less damage to the tissue of the patient. Laser operations are also mostly shorter than traditional surgeries, and they can often be done on a on an outpatient basis. So you also don't have to spend the night in the hospital. And if general anesthesia is required for the treatment, it is usually used for a shorter time. So there's also less risk for the patient. Besides that, the people also tend to heal faster with laser operations, and you may have less pain, swelling, and scarring, as I already said, because it is more precisely. Yeah, what happens after the laser therapy? The recovery after laser surgeries is similar to typical surgeries. You will may need to rest for the first few days after the operation and take some pain medication until the discomfort and the swelling of the operation have gone. And the recovery after the laser therapy varies based on the type of therapy you received. So it depends on what the treatment was, and depending on that, the doctors will figure out the perfect rest for you, like in every other treatment. Of course, always you should follow the orders your doctor gives to you. And if you receive the therapy on your skin, you may experience swelling and very raw, so it's rawness around the treated area. And for the first couple of weeks, everybody should be sure to do the following. You should use over-the-counter medications for the pain, clean the area regularly with water, use ice packs to cool it down, and avoid picking any scabs from the treatment area, because it's very important to for the skin to be recovered.